In the news, I saw this, and you know, my heart kind of goes out to her. Catherine Zeta-Jones, the actress, you're all familiar with her, I'm sure. She checked into a treatment center to treat her bipolar disorder, and she had checked in once before, back in 2011. And she said, you know, this is just maintenance. I have a condition, and I want to keep it in check, and so I'm doing this. And I think it's interesting, you know, of course, I don't think celebrities are able to go to any kind of rehab or anything and not have it not be talked about, but I do love how she's standing up for this condition, and she's sort of has a platform, and she's talking to people about what she's going through with it. And
I've heard her interviewed, and she said that she was a very reluctant poster child for bipolar disorder, that she didn't really want to be the face of bipolar disorder, but that she was willing to do it if it was going to help other people. And I like that, because that's not what she wants to be known for, but if it's going to help somebody else deal
I think
with
it's amazing when women can come out that, like you said, be the poster child. Like, I remember when Brooke Shields came out about her postpartum depression, and she, you know, kind of unintentionally became the spokeswoman. And then a lot of women felt brave enough to come forward and say, hey, I struggle with this too. And so I really commend women like that it's not easy, but if there is something that you need to be treated for, and that you're brave enough to recognize it and take the backlash, because Lord knows she's getting it.
Yeah, and actually she's not the only celebrity. Eva Longoria just a couple days ago talked about.
Okay, I was going to say real quick, over 6 million people are diagnosed with this disease, by the way.
I want to ask a question.
Well, I'm sorry, Susie, can I just finish?
Yes.
People are very reluctant to talk about it because it can be very embarrassing. And like I said before, with mental illness, it's one of those like diseases that people think, oh, they're crazy. No, it's like having cancer. It's like having any other disease or illness.
Crazy.
Exactly. We all have something, right? And so I am so proud of Catherine Zeta-Jones for coming forward, even though she may not want to be. Like we talked about earlier, Susie, sometimes when you have a platform, God puts you in that place where you are that person. Yeah, right. And I think because of her standing for it, so many more people will feel more comfortable, because you got this beautiful woman saying, I have this disease, and I'm getting help for it.
She's being proactive about it, too.
And
she's calling this maintenance.
Yes, absolutely. So anyway, I just commend her for this.
All right, I'm going to throw it out there.
Okay.
Everybody in the whole face of the planet gets depressed.
Yes.
Every human being in the world. And every prescription in the world is given to them. And now there are prescriptions given to them in case the prescription they've got is not strong enough.
Yeah,
so we've got a whole planet full of depressed people, and we're calling it a disease. And nobody is getting to them in the real mental health that says, tell me your history. Tell me about being abused as you were a child. Tell me about the marriage you're in right now. Tell me about all of that. Those don't take a pill.
There are those who weren't abused or didn't have some horrible thing happen in their childhood who are suffering from depression, and there's a difference between having the blues, like we all get, and having true physical depression.
Depression is anger turned inward.
Well, first of all, no,
That's
Susie,
according to you.
Well, no, let me tell you all, just because I know this, because I've dealt with it in my own family, it can be hereditary. It can be a chemical imbalance. Yes, Susie, absolutely. It can be hereditary. So sometimes people deal with this, some have been abused, but some have not. It could be something that you just inherently have.
It could be that you don't like the way you look. It could be, there could be a million reasons.
A million reasons.
I'm talking about chemical imbalances that cause an actual physical condition.
Is a chemical imbalance.
That's not exactly true.
Everything we say.
I think a lot of people are on drugs that don't need to be on them. I think Prozac is overly prescribed, and other antidepressants probably overly prescribed, but a lot of people suffer from this, and it is a disease. It is a scientific chemical thing that happens in your body.
Yeah, let me try to understand. What are you upset? I don't understand what you're part of.
Because I think people are over-medicated today. I don't think they get in touch with the real problem. I think they need psychological help.
But isn't that what going to rehab? Isn't that what Catherine Zeta-Jones is doing?
All right, she goes into rehab, and what do? They put her on drugs.
You don't know what they're doing.
Okay, all right.
Well, there's therapy involved in rehab.
How do you know I don't know what they're doing?
Unless you're friends with her doctor, you probably don't. I'm just saying, you don't know what that.
Well,
I think every situation.
Everything a disease, and then we don't have to be responsible for forgiving people or going to a deeper level spiritually, which really helps us in our relationship.
But shouldn't we be glad that people are
drugs?
I don't
I'm
think it's
so
about
sick
drugs,
of it, I could
but
scream.
but I think maybe it's not about being a disease, but like these people are coming forward and saying, I have a problem. Call it a problem, call it a condition, call it a disease, call it you're crazy, call it you're wackadoo, call it whatever you want. They're acknowledging a problem and they're
there's
trying to
something
get
wrong.
help. So God bless them
This is
for
interesting,
that.
and this is to Susie's point, because she does make a good point about, there is help to be sought that goes beyond taking a pill. And, hopefully everybody's getting the right kind of treatment that includes therapy. But there was a new study out in the Journal of Affective Disorders that says that believing in God is associated with better psychiatric treatment outcomes. So they say that your
Obviously.
level of
Yes.
spirituality is directly related to your level of overcoming your depression and anxiety.
And the attitude of love, which is the finest association of God there is, for us to be more loving, less resentful, less bitter, thinking about ourselves all the time and how bad the past was, all that stuff is toxic. It is the most toxic thing. And what I'm saying, and I get so passionate about, is that when we just go in and tell the doctor we're depressed and he writes out a
Well, I
prescription.
think people
for-
are being misdiagnosed. Some people do have a clinical depression and some people don't. And I think it's misdiagnosis that really causes a lot of problems. So I agree with you on that
Thank
level.
you. I need a friend today.
Oh, you have all friends up here. You know it. We have a lot more to come. Stay with us.